think the idea of this talk has taken a couple of years to get off the ground, and some of that had to do with the resistance of this community to face up to what I think is, we all now accept as a deep-rooted problem. As an educator, I'm interested in how do we affect change in a community like this. As a scientist, I'm interested in the science and the substantiation of the decision-making process. As a community member, I'm concerned for our community. I moved after leaving the university to the perimeter of the university, so I have a much better sense of what goes on after hours on this campus and in the nearby neighborhoods. And as a father, of course, I have concerns for what the next generation brings. And I appreciate that you covered broadly the issues of alcohol misuse and impact on society in terms of injury, accidents, and mortality. There are many, many problems associated with alcohol misuse, and on one of my final slides I have a reminder of all of those because I'm going to focus on, and I'm glad that one of the audience members asked about the older generation, impacts, both positive and negative, with respect to chronic disease. So you see if I... Okay, and I've termed this an epidemiological paradox. When David Catrambone contacted me for a title, I just blabbered out some things. I said, well, there's some interesting science that has been described as a paradox. And so he came back with a tentative title, and I didn't quite understand what it meant or didn't want to use it. And I said, well, how about something different? He says, no, I like that word paradox. We've got to keep the word paradox. So I kept the word paradox. So for those of you who are puzzled by the word paradox, I've gone to Merriam-Webster here to help you out. Something such as a situation, not very specific, that's made up of two opposite things that seems impossible, but actually true or possible. Wild definition, isn't it? It's not particularly proscriptive. But here we're going to apply this to something that maybe some of you are familiar with, and which kind of is probably the most popular paradox in public health, is what we call the French paradox. And this became popular about 20 years ago when we started to understand more about risks associated with cardiovascular disease, and especially the role of fats in diet. And we looked around the world, and there are some countries where cardiovascular risks are quite high and others where they're remarkably low. When you start looking at those risks by what they do and what they eat, the French stand out as having among the highest saturated fat consumption rates. Butter, milk, cheeses, I love all these things. And yet they have among the lowest of the European cardiovascular, coronary heart disease rates. In this study in Ferrier, 2004, in the Journal of Heart, some hypotheses were explored after years of science has accumulated on this topic. Some of the hypotheses explored were, well, maybe French physicians were reluctant to report coronary heart disease or cardiovascular diseases, which was disproven pretty quickly. Total diet versus fat intake. Maybe you can eat a lot of that fat as long as you have some other things that are better for you. Exercise, we know, any of us who've been in France, the French walking around with their dogs everywhere, getting a fair amount of exercise, probably more than we do. And they're noteworthy in having produced and consumed some of the largest quantities of decent red wine. And so that's a hypothesis that intersects with our topic here. Among the conclusions from this Ferrier study is that modest drinking, they define it as 2 or 3 times a day, has a protective effect against coronary heart disease. I think that's reasonably well replicated in studies throughout the world. The theory behind that, I don't think the mechanism is perfectly well known, but it might be that it improves our high-density lipoprotein lipid fraction, and that's strongly correlated with reduced heart disease. They also went further to see, one more point, is that the decrease in all-cause mortality was as much as 25%. And it's not a trivial reduction in mortality. This is all causes combined. And therein lies some of the paradox, is how can you have something that we know is inherently hazardous associated with such a significant and almost profound amount of reduction in mortality when we look at it at this level. This study went further to say that it was the wine drinking, and perhaps because it's a French author, maybe there's an inherent conflict of interest, that they compared with other sources of alcohol and found that that benefit was really consistent with wine drinking, and it went further to say red wine drinking. Well, here's one of the better presentations from Di Castelnuovo. This is a meta-relative risk dose-response graph. They took 34 different cohort studies. From those studies, there were about 65 or so results that were independent observations of the relationship between mortality and alcohol consumption in a prospective manner. These were all cohort studies looking at risks stemming from the exposure through mortality. And at the bottom, there's two scales. One's drinks per day, the other is grams of alcohol per day. And you see that this line, showing the relative risk of all-cause mortality, doesn't return to that of the non-drinkers in a population level until about 4 drinks per day. That strikes me as quite a lot. I know the numbers that mentioned earlier were even bigger, the 10 and 21, I can't imagine, but this seems like a fairly high level. And I put that line there, even conservatively as an epidemiologist, I put it where the upper end of the 95% confidence interval touches 1. So that's a conservative estimate there. So what's going on here? This, by the way, covered over 1 million subjects and included almost 100,000 deaths.